Yeah, Debbie?
Yes, hello. Good morning, everyone. Afternoon or evening, wherever you're at in the world today. We are so thankful to have Dr. Mani Pavuluri speaking with us today about her Feeling Better program. This program intends to build emotional resilience for children and adolescents with a goal for prevention and intervention in wellness and illness. The intervention involves learning about brain and environment and working towards a positive change. There are two parts to this framework, which she will discuss with us today. Dr. Pavulari is a distinguished fellow of the American Academy of Child and Adolescent Psychiatry, professor at the University of Illinois, and founding director of the Pediatric Mood Disorders Program and Pediatric Brain Research and Intervention Center. She also operates a clinical practice. Thank you so much for being with us today, Dr. Pavlari. Thank you and welcome today.
Thank you so much, Debbie, and thanks for inviting and being part of International Bipolar Foundation on the Scientific Advisory Council, as well as being a member of this foundation is an honor. And I feel indebted to be of a part of this large family. And uh, I really am thankful for the invitation and for all the listeners who are joining us today and may listen later, whoever you are. And I'm really excited to be part of this. Um, Feeling better, uh, brain and environmental training towards emotional resilience is an acronym, as you see here, BETTER. Um, is feeling better. Um, the reason why I coined this name is to be able to take the advantage of what we know about brain and the knowledge from having worked on brain to share with the wider community, and also understanding how we can apply some of the knowledge in the field to influence the environment that wraps around the children, which could be just parents or schools for that matter, even, and bring these two factions together to build a better environment, better education, better understanding in bringing up our children. I'm a child psychiatrist. I have had the fortune to take care of like nearly people now in thousands over many years. And what it taught me is several children may have problems in one area and may be called as having a diagnosis. But on the other hand, they have a lot of just problems that may not really amount to any diagnosis and having little issues. In the same way, having brought up two of my own kids who are now, one is in college and one is a junior, so both of them have never been like little angels every single day of their life, right? I'm a parent, and I have seen many other children who grew up with my kids who are supposedly not holding a disorder have time to time issues, and we have dealt with them and we took care of them, and things luckily are okay and more than okay. So through this journey I put together a little bit of program that we will address today. So the current conflicts, I only have gratitude for so many people. There's nothing that really conflicts in terms of disclosure to today's talk. The way I want to discuss today is to introduce you the 3D model. 3D model means 1D is here, the domains and of the brain and developing brain in the developing brain, and the second D is the dynamics in the family and how to address them, and third D is diagnosis if there is one, and that is the last part of it that we can talk about. So now the interesting part is like 50% of the work that I do is educating families a lot of the time in helping develop insight as to what is going on in the brains of these young children, and in fact your own brain too, because it's not that different in terms of the parts, but the developing brain has different ways it develops throughout the young years. So there is a lot of remodeling and normalization that happens in childhood, and I always reassure parents that the children grow up to be reorganizing in their brains, and what is an ADHD in a young age may not be looking like ADHD as they grow a little older, or it could be a very mild problem. And for example, response inhibition or impulsivity improves by 14 years. And so if whatever is left after 14 could be, still considered a problem if they're still impulsive. But you know what? There's a lot of room to grow for these children and catch up. So I just want to give hope and find ways to speed up this development in a very healthy ways of enriching our children's lives. So I call this Feeling Better program addressing normal or so-called healthy children to those who are having a bit more serious problems. It's a spectrum, I think, and brain really doesn't know the diagnosis, so we give those man-made labels. So that's where I'm coming from. And brain plasticity is something I'm really interested in, and a lot of interventions really allow the brain to kind of reorganize itself. And I think that our children are much, much more resilient than we are led to believe. So first, before I explain to you a little bit about brain, I would like to show you how, little parts of the brain work. So this is the brain, right? And I won't complicate my understanding of the brain and bother you way too much, but I will tell you a few basics so that you can follow some of what I'm going to say, okay? So this is the brain, and this part where the Mickey Mouse ears are on either side of your head, it is called dorsolateral prefrontal cortex, okay? This dorsolateral prefrontal cortex is our prefrontal cortex. Dorsal means on the top, lateral means on the side. So this one is a CEO of thinking or cognition and problem solving, to say it in a quick and dirty way. In the same way, ventral or lower part of the brain and lateral side at the bottom part is called ventrolateral prefrontal cortex, and this is the CEO of emotional control, okay? It controls the emotions that are shown in, say for example, amygdala is here, the little, see here, the little almond-shaped thing at the bottom of the brain, that's called amygdala. And this ventrolateral prefrontal cortex controls the amygdala in its overactivity. This is like a fountain of emotions that surge through amygdala if it's reactive to negative emotion, if it reacts to negative emotion. And VLPFC controls amygdala's overactivity, and that's the emotional regions here at the bottom of the brain. And there's a little part called insula behind the emotional control area that makes your body arouse. See, when you're very angry, upset, and steaming, and like feeling like really jumping up and down, or your child is really angry and upset and yelling and screaming, this insula is carrying emotional impulses and how you're feeling in your body and revved up. That is conveyed through insula to the ventrolateral prefrontal cortex. So this middle part is middle manager called cingulate, and then there is basal ganglia that is connected to dorsolateral prefrontal cortex. This is involved in concentration. So I don't want you to be bothered by all the other organs, but the most important thing is CEO of thinking, CEO of feeling, and also amygdala and basal ganglia here, or the caudate. So I would just go on and introduce other things very soon. So let's talk a little bit about normal development. Of course, the kids by around 14, you develop like impulse control problems, and by about 15, you might develop really good, working memory is developed, your ability to keep things online, and even when you grow up to 18, 19, your information processing develops. So over a period of time, various things develops and your brain catches up. And there's always a normal variation between where your child is, whether they are, like a little slower or a little faster, just like how kids walk, a few months early, a few months late. The brain also does the same thing, and brain catches up pretty nicely. So medication is dependent on some of how we do things. So as you see here, again, this is the emotional system here. I want to show you this emotional system. Remember I told you a little bit about the ventrolateral prefrontal cortex, emotional control area, and the cognitive control area. They're all connected together here, the ventrolateral prefrontal, and then all these other prefrontal regions as well, the thinking, the feeling area, then the, the one that loves to tell you what they like and rewards is the orbitofrontal cortex, and then there is amygdala. So there is that cingulate in the middle, and then there is the insula here as well in front of ventrolateral prefrontal cortex. As you see here, the thinking and feeling parts are connected nicely, and then all these prefrontal areas are connected to amygdala as well, and the striatum is the basal ganglia parts are also connected to the emotional areas as well. So, and then you see with the eyes here at the back, the eyes that see things is at the back, interestingly, and it's connected to the amygdala. So I don't want to bother you with it anymore, but I want you to understand that this is the emotional system. And I usually say that the emotion dysregulation is a spectrum, okay? Disruptive mood dysregulation disorder, or bipolar disorder, or severe temper tantrums, or in a normal child, they all involve these regions, It's not like, some regions are involved in a certain way, in a certain place, but all these areas are operational in normal children as well as those who are impacted by serious illness, and it's the degree to which they're impacted and how the machinery is working that differs between children, okay? And so let's talk a little bit about how we operate with the emotional system here. See, the emotion regulation is all about making them feel good, do good, live good. So it's a feel-good factor we are thinking about, so that everybody calms down and nobody is dysregulated and getting angry and upset, getting wrong cues, being really annoyed and annoying you and losing your cool, So I always show, some of these children, there is a chill pill. Take the chill pill. How do you take the chill pill? How do the parents take the chill pill? So, most of how we deal with emotion dysregulation is a little bit about us trying to help help ourselves as parents by protecting ourselves first, and let's figure out how to take care of our children, right? The way we protect ourselves, or the way our children have to protect themselves, is to be able to be mindful and to be able to keep their emotion regulation in check, and be poised in their the way they act, right? So for the severe end of the spectrum, we developed, Dr. West has been the pioneer who developed the Rainbow program. And the Rainbow program that is designed in our program consists of, making sure your sleep-wake cycle is in order for emotion regulation. And then your emotion control needs to be in place. And this is all about more. I will talk to you more about affect control and mindfulness in a minute. Then we also do, and we give medicine for those who are very sick, but not for regular, like people who are temperamentally a little bit more reactive. I can do it is doing positive things and building yourself towards improving your self-esteem. I often ask children to write positive self-stories, write poetry about themselves that on aspects they're good at, or even doing something like writing a story that gives a skill that's good for them, or doing artwork, or whatever they can do. Show me and let us show the world how good you are in doing this. So I foster positive things. Another very important thing I would like to take an opportunity here and stop and tell is we always want to work with native strengths. So that's a fail-proof method, right? So it's a little bit simplified way of saying that we're working with the strengths, but it really is the most powerful technique. Rather than changing things that are negative, we're working to create amazing young children through fostering all the great qualities by showing a searchlight on their strengths. And then we also have a little bands on the hand we put on that say "I can do it" kind of thing, with the rainbow colored bands. So it's kind of encouraging and inspiring for people to say, I can do this. So no negative thoughts, is very important. And your mind is as clear as a slate, and you want to, we all heard the quote, you are what you think. And therefore we really train them to kind of fill our mind with brilliant thinking, and thinking about things that are helpful than hurtful, and for themselves to begin with, and try and see goodness in the other, or otherwise it's too painful, try and get out of the radar of whatever is the negative trigger. And for parents, we say also about living in the now and being very mindful, the N factor, the N of the rainbow. And be a good friend is for children, and balanced lifestyle is for parents. And we optimal problem solving, or how can we solve it, sitting together and solving problems, and ways to get support, surrounding yourself with people that love us, validate us, and support us, so that we can move forward with strength. In fact, the rainbow can help you too as an individual parent. Okay, so this is a neuroscience informed treatment. So for the mindfulness, this is an interesting thing. At some point or the other, we all heard about this, but this is one of my favorite things now to go to. I think you as parents can learn, you can teach this for your children, and kids can impressively do this very well. We tell them to be still, listen, focus, and be aware, and let thoughts flow without judging, and be in touch with all the senses around you. Focus on breathing as it slows down the thinking. Annoying or disturbing triggers can be reminders to refocus on breathing in, and smile as you breathe out, as says Thich Nhat Hanh. You see, he always says, like, when you actually are driving and somebody's like saying, geek, 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 and pushing you forward, I mean, you kind of like want to swear when you're driving in the traffic and things like that. So we all have to think like some kind of a nice bell that's calling you back to feeling good and enjoying, feeling good, so that we are appreciating that we are in touch with our senses here, and we are pulling ourselves together nicely with the noise or triggers that are even negative, and centering ourselves. it's almost like, we have a deep sea of insights within us, and they underlie the wave of outward emotions. So imagine yourself sitting by the river, okay? The river has waves like this, right? Up and down waves. But when you sit on the side of the river and look at your own waves of emotions, and you look at them and understand them, and just watch yourself, listen, and discover all those nuggets of insights that pop up as you look at your thoughts and think about what's going through your mind. And you just don't have to do anything. And it's a very cognitive, and it's very centering for yourself. And I think that really not having to do anything, but at the same time sit and think about what you're thinking, and bringing yourself together in the moment, and taking your time doing this, real, and if nothing else, just watch you breathing in and out, really is amazing tool that you can have and teach your children. And this is central to regulating your emotion and helping your children to regulate their emotion. And that's when the amygdala is known to have calmed down, and we've shown, and other people have shown, one of our colleagues have shown in our department, and a lot of people have shown in the field, that the mindfulness slows down amygdala, improves the prefrontal cortex control on amygdala, and brings you to a calmer emotional wiring system stabilization. Okay. And another thing that I'm trying to do with schools, and which is very interesting, that you can go back and do it in your schools as well, perhaps, through at least education, is helping the teachers to learn about brain function and an emotional system that I tried to tell you about. Tuning into facial emotions and cues, or helping children to look at other people's emotions. Because you see, when you really understand what is going on with mindfully the teacher's emotions or your peers' emotions, you do calm down. You start to think that they may have a bad day. They may be a grumpy people. They may be a resting scowl on some of these teachers, right? So you understand their cues. You build skills to think under the stress of negativity. You're mindful, you learn mindfulness, you prepare the teachers to understand that sometimes the brain domains may be like, having waves of up and down emotions, and we all are different in how we regulate our emotions, and to be a bit more cognizant and be compassionate to create optimal environment. Because if the teachers are grumpy, then the kids are going to be grumpy, and it's like a contagious phenomenon of reactivity that you are setting in. And I think that more mindful observation, more understanding of this emotional circuitry and irregularities and reactivity with visual stimuli of amygdala, all of these would help parents, teachers, and children to calm down and take care of each other. And some education will be a beginning for developing poise in children as well as teachers in schools. So we're trying to work this through charter schools in Chicago, and through this program called Poise. And this is uses all the neuroplasticity principles towards better environmental and in brain and environmental training at a school. So now a lot of people say, how do we help our children to stop video games? How do we stop the reward seeking behavior, wanting to say McDonald's, McDonald's, or going to want to buy a new game or something like that, or even substance abuse in in adolescents, and marijuana use, and or getting up and going to school or doing your homework. There are so many things that are pulling people towards motivation. And the things that I often think about is, I remember my own son, one of my sons is not interested in any of these games, but one of them, it has been more so, not now anymore as much anyway, and they used to love Xbox, and then we bought them, and then I suddenly read about and learned a lot about this habit forming loop, and understood all this motivation circuits. And we don't want to entrench this wiring of very tough habit forming loop between the orbitofrontal cortex that attributes the salience to the habit or reward, and ventral striatum, that's bottom part of the basal ganglia, that that really gets excited when you see the reward. This is the habit loop, and amygdala tells you, I want it, I want it, and then the emotional control is less, then this is hyper, then the value is heightened here, and this one, if it is weak and deciding wrongly, then you end up forming this habit loop. And this thinking rational brain here is not really working as effectively because this takes over, and it has its own perpetuating kind of habit formation and motivation. The thalamus is just a gateway, and this is supplies dopamine. So basically, this habit loop is very dangerous. So, I mean, I don't know. You may think I'm crazy, but I just took off that Xbox and I told him I gave it to Salvation Army. He just jumped up and down for a little bit and he had to get used to it. And subsequently, he downloaded some free games and blah, 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 played. And, there's always individual variations in youth, and you kind of let them do some, and then you sometimes let them, learn and negotiate with you. And I will come back to talking about punishment a little bit later, but I personally want to also take a little side route here and tell you, I don't believe a lot in punishment, at least immediately, although I really do not, I do put limits and stuff, but I think that it's very important for young people to be influenced about what is right and wrong. They know that anyway, but being able to educate them, influence them. Some kids listen, some kids don't listen. There's a big margin as to where normality and abnormality is. But you know what? You work through the system and help them and try and try and try again. I think that with good parenting, and if the kids are relatively smart and able to get this idea into their brain, over time it'll work. Over time, I said, it doesn't work immediately, but kids will change. If you introduce alternatives, introduce role models, introduce more thoughts about how to work with their own other native skills, and using teaching moments and talking directly about risks as well as sensation seeking. I also believe in exploration of the adolescents in terms of, exploring, not always going with them to every little corner shop. If they have an opportunity to walk at least like 100 feet around your home, they should be allowed to go, right? A little bit, provided it's safe environment. But something like that, and increasing the repertoire of children and not being constrained in smaller areas that they want to form habit loop, could expand and energize these children and stop them from seeking immediate gratification. A lot of parents say this is obsession and stuff, but it is really, obsession is something different. Obsessive compulsive disorder is different than this habit or reward seeking, and I clearly explain the difference between the two. And I wouldn't go into that right now. So I want you to understand that there's no easy method here, but this is the system that's behind motivation in normal as well as abnormal population. And in abnormalities, this ventral striatum is hyper and OEFC is underactive sometimes, and sometimes they both are active depending upon the type of problems they're facing, and amygdala is always hyperactive when things are out of hand. So some of these things are variably seen based on the problem within the motivation system. So as I say, it's all about, looking at better rewards. Teenagers actually, by the way, love rewards and work with rewards better than even children and adults. And I think the time and effort are required in getting any reward, and effort-based, quality-based work is what we emphasize and teach. And also, you know what? Over time, I would I wonder, I don't know who is listening to me, but I think you're all very brilliant parents. Who am I to tell suddenly and patronize you, telling about simple things? That said, I want to say one of my philosophical point of, not really buying a lot of things for our children all the time, because, I don't feel like parting with my money too much, to be honest with you, all the time. Although, we kind of want to, money is to help our children to get good stuff. I mean, I believe that and I give them good stuff. Don't get me wrong. But I think I tell parents all the time, even in my practice, that a good pat on the back and a little, a hug saying how fantastic they did and how brilliant they are, or having a phone call to your parents, or that is grandparents of children, and telling them, bragging about how good they've done on the phone. They're all kind of wonderful things that they listen directly and indirectly, and they get the oomph from us as parents. And that's when I think that they have a sense of competence that I want to work from when it comes to motivation. So in succinctly telling you my philosophy, I'm not too crazy about punishment, and I do care about influence. And now coming to response inhibition, this is where ventrolateral prefrontal cortex. Remember I told you this is emotional control area. Now that you're becoming really experts on brain, right? I'm not looking at any of you. I don't know. I kind of miss you, not seeing all of you straight away into your face and look into your eyes and stuff. But I hope that I'm making sense here with all these complex diagrams. But you know what? This is not really complicated when you really understand brain like a child's play. And this ventrolateral prefrontal cortex, trust me, is fully established as emotional control area, but it's also a control area for impulse control. Okay, it connects with striatum. There's so many areas in the brain that are connected, but for quick and dirty reasons I'm trying to explain to you, dorsolateral prefrontal cortex also exerts cognitive control along with ventrolateral prefrontal cortex, and controls the the subcortical striatum, and this through dorsal anterior cingulate, the middle manager here. This is the these are the main regions of impulse control. The reason why the emotionally dysregulated kids also tend to be impulsive, in part, is that the emotional control area and impulse control area are sharing the same CEO here, ventrolateral prefrontal cortex. And striatum also serves some emotions, also serves reward system, also serves like concentration and habit formation, as well as involved in also learning and also impulse control. So there are a lot of things that overlap in the brain, and that's why in children, if one thing is involved and one thing is affected, there are many things are impacted in the brain, and it's very important to know that one diagnosis doesn't mean a thing. You usually have 2 or 3 things going on in terms of dimensions of the brain, or like response inhibition is a dimension, emotion regulation is a dimension, motivation is a dimension, or domain rather. So that's what I'm trying to talk to you about, the impulse control. So by the time I figure out what I'm going to do, I've already done. Oh my God! Self-control, what lies is our power to do it. Lies in our power also not to do it, said Aristotle. So I think some of these interesting words trigger us to think that we want to do, but we can also stop ourselves from doing things. And even Aristotle, a long time ago, said the same thing. But although of course he's very brilliant and he's amazing and it's time tested, but you know, we are people with well-developed prefrontal cortex, and as I told you, some of the prefrontal regions can help exert emotional control on amygdala. And the more I educate my young children and my practice and also my own children, they understand very clearly about the fact that they have to develop rational mind, they have the control, they can do this. And I tell families, by drawing pictures of the brain on the paper and help them understand it, please don't make a permanent decision for your temporary emotion. Is a Facebook thing that we all have seen. So, I mean, I think that this really endurance of how to stop and think is an age-old thing we talk about. And some parents tell me, he has no filters, no thermostat. So thermostat is knowing where the emotional situation is, filters are how to kind of screen out things. And I think, you know, this is a critical thing for not being in the face of a lot of things that go on in the classroom and stay away from triggers. A good best friend or a sidekick is really good to keep some emotional buffer in the classroom. And I think the good teachers, compassionate teachers, are always good in the classroom so that they're not triggered off into negativity. Feeding them nicely on time is really good so they're not so impulsive. And, you know, there's so many triggers for our children. So understanding the triggers, helping them to learn how to influence their own brain, and helping them to develop some cognitive control, which I will be telling you in a minute. Another domain that also involves response inhibition in some aspect. So it's always important to help them to piece it together and ahead of time and practice them. So I actually would role play with children and role play with parents, and I help parents to educate children about this and practice with children. And sometimes it's like masterly inactivity on the part of parents too, and I'll tell you more about parenting in a minute. Well, by the way, only have like about 20 minutes, and I still have to talk to you about executive function and cognitive control, as well as some social stuff and parenting. Well, anyway, I'll keep going a little bit faster, okay? And I'll give you 10 minutes maybe or 15 minutes to ask questions. So I'll kind of rush through this. But you know what? Also, by the way, please tell me if you need more of these kinds of sessions, or particularly focus on specific things, or just do question answer sessions, things like that. Just please send your requests and your feedback to Debbie Brown or Miss Muffy Walker, very amazing woman who's an executive director, same as Debbie Brown, and our brand new Lori Butler. All of them are amazing people in International Foundation for Bipolar Disorders, you know, and I think that they can help us help each other in this process of learning about brain and learning more about it. And you can teach me how to teach. You can teach me how to expand on things, and we can be better in helping more people in this way, okay? So anyway, cognitive control, here is dorsolateral prefrontal cortex, here is the thalamus and striatum, our good old striatum. And then there is a frontal area connected to back of the brain called parietal lobe. So there is a concentration, cognitive control concentration circuit here, and that helps in gaining attention, maintaining attention, and maintaining flexibility. All of this is called cognitive control, along with response inhibition that I said in just a few minutes ago. And I think that executive function sort of overlaps with cognitive control. I just have to stop this one. Hey, I'm on a conference call. Bye. Sorry about that. So, what's the plan? What are the problem solutions? What is the gaining attention, organization, flexibility? These are all the various things that are involved in executive function. And this is very important aspect, different aspects of higher cognitive function in the brain. And we approach these individually also. So working memory is part of this, and also attention, maintenance of attention. So we need to dive into details much more on every individual aspect to gain perspective, such as breaking down into little parts and arranging tutors, getting them to organize, finding good fit in the school, helping kids to learn well, giving them time and space. All those things we can work on. So the most important thing is, more than learning attention training through computers, the real life translation, work in real life about gaining these organization skills, work in real life to gain flexibility and problem solving and planning ahead. So that's what I'm interested in through Feeling Better project. And I would love to talk about this. So this is like a multi-domain model where cognitive control, response, inhibition, emotion, motivation are all together in the brain, working together nicely. And you're your own boss, you know, and you can control this. And the most important thing is how you do it within your family. That's the dynamics of the environment. The nature and nurture come together. The nurture is you, the nature is the brain, and all the community that surrounds your child, and the brain and the people that are really important. So you may be mom and dad with your baby, or a single man parent, or two man parents and one woman parent, or different races, and combined family with two families coming together. It could be any number of, every family is cool. And it's the quality of relationships that we offer and surround our children, and our children say, we need you, of course. What I do is I want families to develop from their strengths, and I ask parents to write 3/4 of a page writing their strengths, an essay about their own culture, values, skills, attitude, and knowledge. Values means V, C is culture, S is skills, A is attitude, K is knowledge. I say it very cool sack, to just remember for you. V for value, C for culture, and S for skills, A for attitude, K for knowledge. So values means what is expected in your family, for example, what roles you play. Culture means East-West culture or ethnicity, and what is important for you. That's different from family to family, And then the skills are, for example, I tell parents about remembering this acronym, EARFUL. E is empathy, A is being authoritative, R is respect, and full is consistently fully practicing this empathy and authoritative reasoning, and R is respect and also reasoning also. And then so when you have a disagreement, that's what you want to do. Give an earful from you. Listen and empathize and reason and respect. So in the attitude way, another acronym I use for attitude is perk up, being actually very again, you can use like you can be precise, empathic, and respectful, kind, and upward, in how you deal with your kids, and patient. P is also for patience, so the knowledge is, of course, education and development, which we are all talking about right now. So all these things, you may already have your strengths. So write yourself an essay, do yourself a favor, and write down what you are about. So it's not about Dr. Pavuluri, Mani Pavuluri teaching you something. It's about you as a parent, what you already know and bring to the table, and that's really important for me, because you can teach a lot of things by who you are and how much you know. Dynamics are about what you perceive in your family, what you like to see change, and bring some difference in your family and focus on that, how you and your husband or your partner may be relating to, and you and your child may be relating to each other. So that's important to, or one particular kid versus another particular kid, understanding that. So bottom line is bringing the best in you, and I think you got a lot of tools, so making sure we work with it. And the diagnosis, of course, clinical treatment is very similar to normal development, but with dissimilarities in the incredible seriousness and hurt and pain and hardship that you go through, with lots of difficulties in multiple areas that are often present in some children. And then I again have an acronym ABCD, which I spoke to in the past: assessment, brain function, chemistry or chemical intervention, dynamics, and delivery. So this ABCD is what I work the model with the children, and it's a translation of science and service between that, and decoding with the domains that we talked about and the disorders that are often present. Reading, writing is what teachers talk about, and then the parents have these concerns that, oh, my kid is bullying, my kid is worrying, my kid is failing, sort of thing. So it's a matter of bringing together. So a lot of people say, oh, it's anxious, it's anxiety, it's ADHD, it's disruptive mood dysregulation. In part, it could be a little bit of everything put together. Who knows, right? So we need to figure that out carefully. And then each disorder can have multiple domains and multiple illness medications and combinations and different kinds of things that we need in therapy. So the ABCD model, that's the assessment here, understanding the brain, understanding the chemistry, understanding the dynamics, and work at all these levels. And this disorder is a model that we approach, and biology and medication algorithms are informing each other to give the best treatment for everybody. So thank you guys for listening, and I just covered child psychiatry, normal development, child psychology, parenting, mothering, all kinds of things rolled into one and across brain. And I'm so sorry I had to somewhat tell you in a short time, but I hope you enjoyed it. Okay, thank you so much, and you can ask questions or whatever, or contact me in email or something like that. Okay, thanks.
Wonderful. Thank you so much, Mani. That was wonderful. We appreciate all your insight. And we do have a question. Thankfully, my son has been stable since February. However, he continues to stay in bed a majority of day and night. How can we help him be a part of the day and out of bed?
Okay. I think that he's up at night and sleeping in the morning. Is that what you're saying? How old is the son?
Sorry.
I wonder.
He stays in bed majority of day and night. So he doesn't get out of
How old?
It does 28, she says.
28. Okay. Yeah. Well, he's not a child anymore, so we're talking about children right now. So, I mean, he's an adult at 28-year-old. The way I approach that for someone like that is to provide with the basics of, you know, uh, uh, if the child is living in the parent's home and is 28, then I would look at the quality of life for them if they're incapacitated. I would create an environment, part of the house, that is comfortable for that person, but at the same time starting to have a dialogue about what's the budget for the money and they require, what is the food they require, and what accommodation would they require in the future if they leave home, and what would that might look like a halfway home. As a parent, you might have to have the guts to kind of cut the cord to place them in a halfway home if they are so incapacitated that they're in bed round the clock. But if a young adult doesn't want to leave home and you do not have the heart to let him go, I think I would just go for, they're probably extremely rock bottom, although they may be functioning at some level if they're in bed all day long. So I would just go for basic life skills of eating and surviving first. And I think that I would, I have in the past tried to enlist some people that my child would like, or their child would like to kind of visit or provoke or probe into their life a little bit more, and create external engagement of other people in the life of the young one. That's another one. And then I also, if you have any money or financially, if you're able, create a trust fund and plant them somewhere where they can survive with some basic funds placed for them. That's what I advise many young adults, parents. Because the parents have also their own life to live too, right? And their husbands and other things. So, it just gets complicated.
Great, thank you for that answer. The next question is for bipolar disorder. Our daughter's medications seem to hold her stable, but she is depressed all of the time. How can we help her out of the depression without using SSRIs and sparking a mania?
No, okay. So there are, first of all, to understand the kind of depression, you want a clinical assessment if it's a bipolar disorder. And there are many medications like lamotrigine that are really pretty cool to be used in depression with bipolar disorder in specific. And there are some different within psychotropics, different medications like Abilify that really have a slight potential for improving depression, and various combinations can be used if there is anxiety, such as Buspar and things like that. And also, apart from that, I also believe that there are some extracurricular activities we could shape around young ones to kind of create a sense of accomplishment by little sparking interest in them, like creating, the 3 things to do in a day, for example, or, doing something good for somebody, or just visiting somebody, or small goals like that. I would start to create spark. And some of it is to do with back and forth dialogue, I think, with the young person themselves. Yeah.
Great, thank you for that. It looks like that's all of our questions for now. However, as Moni mentioned earlier, you can email either her or myself at a later date if something comes to mind, pops to your mind after we finish here. My email is dbrown@ibpf.org. And I wanted to say once again, thank you so much, Dr. Pavuluri, for sharing with us today your insight and information, and we hope to have you back soon.
Thank you very much. And I'm sorry I don't have like magic bullets for some of these questions, but I hope that it's an organic, ongoing discussion, and I hope that we all pull together our resources to create something great magic for our young people, regardless of where they are in their development. Even if they are young adults in transition, we need to support them, love them, and care for them. At the same time, I think we need to look after yourself, and I hope you do. Take care, and see you at some stage, and talk to you soon. Bye.
Bye-bye.